Good morning, good afternoon, good evening, and welcome to the AI for Good Global Summit, all year, always online. My name is Xenia Fontaine from the ITU, the International Telecommunication Union, and I have the privilege of introducing today's webinar. The ITU is the United Nations Specialized Agency for Information and Communication Technologies, and we are also the organizer of the AI for Good Global Summit alongside Express Foundation and in partnership with 36 UN sister agencies, ASEAN and Switzerland, our co-convener. The goal of the summit is to identify practical applications of AI to advance the Sustainable Development Goals and scale those solutions for global impact. And like the most of the world, the AI for Good Summit has gone digital, with the weekly programming allowing us to reach even more people across the globe. And now I would like to introduce today's moderator, Ulla Jasper, who is a policy officer at Fondation Botnar, a Swiss-based foundation that champions the use of AI and digital technology to improve health and well-being of young people in growing urban environments. Fondation Botnar has been the partner of the ITU and the AI for Good Global Summit for the last few years. Ulla, welcome, and the show is all yours.
Thank you very much, Xenia. Thank you, everyone, for joining us this morning for this very exciting panel on digital rights and emerging questions for children and young people. My name is Ulla Jasper. I'm the policy officer at Fondation Botnar, and we work here in Basel, Switzerland. And Fondation Botnar is a Swiss-based foundation that seeks to leverage AI and digital technology to improve the well-being, the health and well-being of young people and children in urban environments. Let us watch a little video to show what Fondation Botnar works and how we work.
The first 1,000 days of a child's life are crucial. The brain's window of opportunity. A key period of development. But why let it stop there? What if we were to think further than the first 1,000 days? What if we began to focus on the second decade of life, on adolescence, the young and dynamic digital natives, often neglected during a period where behaviors are formed and choices are made? Let's look at the year 2030. Almost 2 in 3 people will live in cities. Children left to mature in a playground of concrete and glass. At the same time, the world will also face a shortfall of 18 million health workers, a detriment to the health and well-being of our future. Now is our time to take action. Now is the time to create a paradigm shift in health, supported by innovative solutions. We need to move away from a main focus on disease treatment and care and focus on health promotion and well-being. This new city dweller generation needs our attention. But how do we achieve this? By transforming urban spaces, making them fit for children to flourish, both physically and mentally. By integrating artificial intelligence and digital solutions into the health ecosystem, making it much more predictive and personalized. And finally, through collaboration, from national government to cutting-edge entrepreneurs and to young people themselves, we bring the brightest minds together to develop sustainable and scalable solutions for the next generation. We need to work together. We're Fondation Botnar, the future now for children worldwide.
Thank you to ITU for showing this video. Before we jump into the panel and before I introduce the topic and our panelists today, I just want to make sure that you all are aware of the social media work that's going on. Please follow our conversation on Twitter and on Facebook. You see the hashtags and handles at the right side of the slide. And I'm sure there will be a lot going on during the panel, but also perhaps afterwards, where you can follow the conversation and continue it further. So our panel today deals with digital rights and emerging questions for the well-being of the next generation. And it's almost a truism by now that over the past years, digital technologies and AI have basically massively changed our daily lives. Innovations are rolled out at an amazingly fast pace and in all kinds of economic sectors. It's not limited to one sector, but it basically affects all economic sectors. It affects our working environments, our health systems, and it affects education in schools and universities. While this affects all social groups and societal groups, it doesn't affect everyone to the same degree. Arguably, the situation of today's children and young people appears particularly complex. For many of them, it's already a reality that their lives will be fully digitally monitored. They lead digital lives. They are the first generation that experiences a fully digitized childhood, as Deborah Lupton argues. And they are the first ones to lead truly digital lives. And AI and digital is playing an increasingly important role in the education and in learning, but also for the health and healthcare, and really for the broader realm of their well-being. For example, digital and AI-driven tools and interventions such as diagnostics or therapeutics are designed and deployed in their healthcare. But similarly, technology-based education tools offer the possibility to personalize and tailor learning environments specifically to address young people and children. And networking applications allow to engage, to participate, and to connect, as we all know. However, while this presents opportunities for promoting health and well-being, the specific impact it has on children and young people is often disregarded. So, for example, very few countries actually have digital child health policies, and very few countries specifically reflect the particular needs and the vulnerabilities of children and young people. Health policies rarely consider how the digital transformation of health, but also of other systems, impacts on critical issues for children, such as privacy, safety, inclusion, empowerment. So what's the impact of these new tools, of these new programs, which aim at, for example, children's health literacy, which promote healthy lifestyles? How does the digitalization of health systems help or harm children or young people? All these are questions that aren't really asked and answered in full detail. And I think a lot needs to still be understood to get a better sense of how these new technologies affect children and young people. So we are very pleased and very grateful to have the chance today to look into this topic more closely and to introduce, to do this together with our panelists, whom I would like to introduce before we then dive into the topic and into the discussion. So we have, in alphabetical order, Meg Davis. Meg is an anthropologist and human rights advocate based at the Graduate Institute in Geneva in Switzerland. And she's also the lead of the Digital Health Rights Advisory Group, a consortium of civil society actors and academic researchers. Meg earned her PhD at the University of Pennsylvania, and she was the first senior advisor on human rights at the Global Fund to Fight AIDS, TB and malaria. She held various fellowships at esteemed universities, and she actually also published a new book, which was just came out. It's called The Uncounted: Politics of Data in Global Health, and we probably have a chance to also talk about her findings from this book. Then we have Rajat Khosla. Rajat presently works as Senior Director for Research, Advocacy and Policy with Amnesty International. He's a lawyer by training and specializes on issues related to global development and human rights. Over the last 20 years, Rajat has worked on these issues with OHCHR, UNDP, UNFPA, and most recently also for WHO. He has worked within specific contexts of countries in Asia, Africa, and Europe, and also led development of global and national policies in this regard. Then we have Yassine Ndiaye. Yassine has a bachelor degree in biochemistry and women's and gender studies, but her passion for equal access to healthcare drove her to pursue a master's degree in global health at the University of Geneva. Alongside her academic training, she has a lot of experience in working as a sexual health activist, an environmental health technician, and recently as a consultant at Gavi, the vaccine alliance focusing on measles and rubella program management. Yassine is currently one of the 12 members of the Young Experts Tech for Health, which is a platform for young people to shape and guide the agenda of like global health making, so to say. And we will actually hear more about this group of young experts later on during our discussion. Then we have Tony Stower. Tony is the Director of External Engagement at the Five Rights Foundation. The Five Rights Foundation is an organization established in 2013 to promote the rights of children online. And working with an interdisciplinary network of experts, the foundation develops policies and regulation of digital issues on behalf of children and young people. It has pioneered a range of international policies and programs and has provided a lot of thought leadership in this field. Tony has a background in complex policy development and communication in the public sector. And most recently, he led work at the NSPCC, the UK-based National Society for the Prevention of Cruelty to Children. Okay, so without much further ado, I would like to jump into the discussion right away. And I hope that we have a discussion approximately until 10:55, and then have time for the Q&A from the audience. But let's jump into the discussion right away. Yassine, I would like to start with you because, as I said before in the introduction, you are one of the young experts of Tech for Health, which is a platform for young people to shape and guide the global health agenda and to advise on technological transformation in health. Could you tell us more about this consortium or this group and about your views how to best leverage digital technology for health?
Thank you so much, Ola. It is such a pleasure to be here and join you all from all over the world and discuss this topic. So for the Young Expert in Tech for Health, as you've mentioned, we are made of 12 members, and each two of us from the 6 WHO region. So we come in this group with a very diverse background in terms of demographic, geographic, and also expertise. And together we we do a lot of things, and two of those being one, we are working and advising the Transform for Health coalition, which is a coalition made of different global partners whose efforts and work is around advocacy, communication, and also accountability for AI, digital and frontier technology as a catalyst for 2030 UHC agenda, and Fondation Botnar being one of those partners. And the second things that we are working around is really over the next 2 years is designing and implementing initiatives and campaign that really highlights the intersection of youth, digital technologies, and global health by building networks of young people globally, and especially drawing the attention to the best practices and generating opportunities for engagement. So in other words, we are really here to bring here in this discussion of AI and global health, the youth perspective, and really making sure that as young people, we are engaged at the policy-making level, at the global level, but also we communicate and with our peers to make sure that our voices are heard and our voices are part of this decision-making process. And the second part of your question being around leveraging technology for health. I believe that, which will sound very rhetorical here, but I believe that one of the really main thing that we need to do to really leverage technology for health is to really focus more at engaging young people and putting us at the center of a discussion. And there's various reasons for this. One being that health is so deeply rooted in political and socioeconomic context in each community that it's being performed in or is being talked about or whatnot. And given that as young people, as you mentioned before in your introductory remark, that we are at this stage, we are one of the few generations going up, the few generations now that have grown up and that really have been center of technology. We've seen technology be born, and we've really participated in making it what it is now. And I think we are at a crossroad between communities and also this tech world. So I think young people are at such a space where we are able to bring back these two words together, being able to not only understand technology, understand what it's about, but also reaching out to our communities that we are in, and being able to really make sure that the uptake of technology not only answers the need of the community that we belong in, but also it's done in a sustainable and equitable way. And I think our position really makes it such a critical role. And I think there needs to be more engagement for us to really push for sustainability and equity. And also, I think it's important to understand that as young people, when we talk about engaging young people, we don't really mean at the end user level, but really engaging us from the get-go, from the research side, from the data collection side, to the making of a technology all the way through the user end. And once all of these steps we are involved, we are able to bring in our community views, we are able to bring our own experiences. And I think that will really push for a very sustainable, again, and equitable way of leveraging technology for health that will be useful and very critical to all communities involved. Over to you, Ola.
Thank you, Yasin. Thank you. That was such a powerful and strong, stimulating statement. And actually, I would like to pick this up and basically hand it over to Rajat, because Rajat, you've also spent a lot of your time, your work time, your professional life, basically working with women's and children's and adolescents' health. And these are also groups that often get neglected, not just in health policies, but more generally. They are not really, they're not integrated in policy making. They often don't have a voice, similar to what Yasin said about young people more generally. But how can we ensure that this growing digitalization, which is happening, we can all see it, but how can we make sure that this is not leading to a widening of the gap that already exists? How can we make sure that marginalized groups, not just young people, but other groups that are marginalized in policy making, how can we ensure that they get integrated, especially when it comes to digital and AI and modern technologies? Rajat, what's your take?
Thank you, Ula. And let me start by my thanks to Fondation Botnar and to ITU for this event. And it is a unique opportunity to discuss some of the issues, and very much would like to build on what Yasin just started saying. But let me start with the caveat in terms of the way digitization is taking place. We find overly that the emphasis is too much on the technology and too little in terms of for whom and to achieve what. And therefore, at the outset, what I would like to emphasize is the need to change the narrative. What we need to do is to have a conversation from the perspective of looking at children and young people, not just as passive recipients of digitization and technology or technological solutions, but as active agents of change, as she very rightly emphasized. And in so doing, what we need to do is to critically examine the question, why such technologies are being introduced and for whose benefit. Because we know while many digitization initiatives have taken place and are often very well intended, they haven't actually resulted in positive health outcomes or overall outcomes. And we are repeatedly seeing is that good intentions alone are not enough. And therefore, we need to be cautious of the tech hype, the overconfidence in and inflated expectations of what technology and digital solutions can actually deliver, and the so-called tech solutionism, which often masks the complex underlying issues, which actually my previous speaker very nicely highlighted. And because if you define the problem incorrectly, it is inevitable that the solution or the tech solution that we are talking about will be flawed and will have adverse and unintended consequences. And we are seeing this particularly happen in context of children and young people and other marginalized populations as well, in which tech companies are often implementing interventions without robust safeguards. For example, if you look at the experiences with multiple online platforms, we are seeing that problems such as social media addiction, cyberbullying, inappropriate content reaching children is becoming far too symptomatic of a wider and systemic problem with the use of technology without adequate human rights safeguards. And therefore, the risk of digital health policies are enormous unless proper safeguards are being put in place. However, one thing that COVID-19 pandemic has shown is that technology can and should be used to play an important role in helping stop the disease, including spreading of public health messages. However, we have also seen how certain governments, in the name of combating disease, have rushed through and implementing use of surveillance technology to track individuals and even entire populations. One such example is that of tracing apps, which are becoming ever so popular. Amnesty's Tech Security Lab have reviewed multiple contact tracing apps from Europe, Middle East, and North Africa, including detailed technological analysis of 11 apps and exposing the security vulnerabilities that are confronted. Which begs the question in terms of then what is it that we need to do, and what are some of the important considerations to bring in some of the issues that Yassine was talking about in terms of young people's participation, but also ensuring that implementation of such technologies do not lead to unintended harmful consequences for certain population groups. I think the first and foremost thing to emphasize is to take a human rights approach when introducing digital technologies for health. Amnesty's Toronto Declaration on protecting the rights to equality and non-discrimination in the age of artificial intelligence lays out in detail the human rights obligations and safeguards in this regard. For example, states must identify human rights risks before deploying AI and not use or allow use of systems that discriminate or lead to discriminatory outcomes. They must also ensure transparency and accountability in development and use of AI systems and enforce robust independent oversight over the development and use of these systems. We mustn't forget that companies themselves also have human rights responsibilities. Under the UN guiding principles, companies have a responsibility to respect human rights, and this includes respect for potential discriminatory and to identify, potential discriminatory outcomes, and to take effective action to prevent and mitigate discrimination and track responses, and be transparent about efforts to identify, prevent, and mitigate against discrimination in machine learning systems. There is an awful lot to be said in terms of how we need to ensure that digital technologies for health, and broadly as well, do not further deepen existing inequalities, and due consideration to be given to social, economic, ethnic, and gendered considerations. But I'll stop there now and would come back to some of these issues further in our discussion. Thank you. Over to you, Ula.
Thank you, Raja. That was already a powerful statement about what needs to be done and what should be done by the international community, by civil society, by global actors as well. But before we address perhaps the kind of the governance questions that are emerging or that should be emerging, I'm wondering if we already know enough, and that's actually something that has been voiced before. Do we already know enough about the impact the new technology has on children? Do we have a nuanced enough understanding of what it means to lead a digitalized childhood, for example? And Tony, I know that you have, and the Five Rights Foundation, you have produced a very important and actually very nuanced book just recently on how digital technology affects children and how it impacts on digital childhoods. Can you tell us a bit more about the book and about this? Yeah, can you give us a better, more nuanced picture of digital childhoods?
Well, thank you very much, first of all, for inviting me here today. It's a real pleasure. The impact on children is of the increased digitalization of our world is absolutely astonishing. As you said at the start, Ula, children really do live their lives without any distinction between online and offline. And we've mentioned several times this morning that that children are often digital natives. I think that is actually it's a very Western-centric term, and I think that is certainly true of many children in the global North. I'm not sure that's true yet of children in the global South, although increasingly it is. And we've seen enormous growth in children's access online, of course, in sub-Saharan Africa, and there's special issues that we need to think about when we tackle that. We might address that later on today. However, I think it's relatively simplistic to talk about children as being digital natives, because that assumes that children know and understand the way to navigate the systems and services that they frequently use. In fact, we know that that's not the case. Children may know how to use the technology, and they may understand the features relatively more quickly than those of us of older generations. But children are still children online, and these systems and services are usually designed entirely for adults without recognizing the special needs and protections that children have. It's really important, I think, that Rajat mentioned human rights, and I think that's a topic that's going to come up several times today. The UN is currently consulting on a general comment on the UN Convention on the Rights of the Child, which recognises children's needs and rights in the digital world. That's a really important statement, I think, for the first time recognising that children do have rights that exist online, that are special and separate and firmly rooted in the rights that and protections that we provide children offline. Ula, when you ask about the impact on children, I frequently turn to academic research, and there's an enormous amount of research now that shows that there are huge negative impacts. For instance, in the UK, which is where my specialism lies, last year there was 10,000 online offences against children, ranging from grooming, from sexual grooming, from blackmail and other types of online abuse. These are offences that are and crimes that are purely facilitated online and simply couldn't have existed 10, 15 years ago. We've created a system and a series of systems that simply don't have the protections in place for children. And we know that that online systems, and in particular AI and algorithms used on systems like Instagram and TikTok, are continuing to drive children towards content and conduct that is dangerous for them. So when you look at a recent report that came up from the Children's Society, another NGO here in the UK, it showed that children in the UK are increasingly unhappy. And in fact, adolescents in the UK are the most unhappy in Europe. And part of that, children tell us, is driven by body image, is driven by the constant need to perform online and to search for likes. And of course, nobody is suggesting that social media is the sole driver of this, but it's clearly a large part of the problem. As I said at the start of my remarks, one of the problems here is that these systems and services simply aren't designed for children. And we need to recognize that every time that there's a risk that children face online, that is as a result of choices that the companies have made. Choices that continue to drive children down towards more and more risky content that suggests, for instance, when young children and young people start to view images of how to lose weight, then it's very common for them to be driven down a rabbit hole of pro-anorexia and eventually pro-suicide sites. And we've had several tragic cases in the UK of children who've taken their own lives after being driven down Instagram rabbit holes there. It's systems that allow adults to contact children who they don't know online, exposing children to grooming and sexual contact risks. It's systems that encourage children, that nudge children towards broadcasting live from their bedroom with profiles that are open. And we've seen lots of children, both in the UK and around the world, being encouraged to trade sexual acts in order for more likes and more viewers. These are systems that are simply not acceptable. It's not acceptable to continue to expose children and treat them as adults online. What we need clearly is agreement that children's rights and protections that we already offer them offline must be offered online. And Rajat is right, I think, to talk about the responsibility that the service providers have here. They have responsibility to respect human rights and the risks that their services pose. And they have a responsibility that they can't shirk and they can't push off onto parents and children anymore. For too long, the narrative around all of this has been that if children are facing risks online, that's as a result of bad education or bad parenting. And we know that simply isn't the case. So in the UK, as in many countries around the world, children's internet use has doubled, perhaps tripled since the lockdown began in February and March. There has not been an increase, a concomitant increase in the amount of protection that the online services provide. In fact, we saw some companies, including Facebook, furloughing many of their moderators at a time when the risks to children were escalating online. That clearly isn't acceptable. So my concluding remarks are that risks to children are enormous, but we shouldn't pretend that the answer here is to close children off from the internet. That would be unacceptable, and that isn't what children want. They're in fact voracious and enthusiastic consumers of online services, and that's a great thing. You know, the internet is perhaps the best thing to have happened in my lifetime. It's really important now that these companies, however, live up to their expectations. And we see some advances in regulation coming from the UK, Australia, and of course the EU with its new Digital Services Act consultation. I'm really hopeful that over the course of the next year or so that we will see some changes here, perhaps voluntarily from the companies, but certainly from regulation. Thank you.
Thank you, Tony. If I can just pick up on what you said in your closing remarks, there are some scholars and child rights scholars primarily who argue that while there is a clear and undisputable need for stronger protection, we must not lean too much to the prohibitive side. And we also need to keep in mind that the internet and social media allow children and young people a lot of potential for empowerment, for participation, for connection. So what do you think about this? Is there a balance that we need to find? Is there a certain danger that we now lean too much towards protection and
it's a really interesting argument.
Sorry.
It's a really interesting argument. I don't think it's a binary. It's a completely false binary by suggesting that we can either have an open internet that people can enjoy, or we can have protection online. In fact, we can have both, and that's exactly what we have in the offline world, where we recognize that some spaces for children need to be adults shouldn't have open access to, and that we recognize that children should deserve and have protections. In the online world, the crucial thing, I think, is that companies need to understand the risks that their services pose to children, and they need to assess those before they roll out the changes. So, for instance, Facebook at the moment, I don't mean to pick on Facebook, it's just a really helpful example. Facebook at the moment makes about 15 million reports every single year of child sexual abuse on its platforms to the National Center for Missing and Exploited Children in the US, where it's required to make these reports. It makes about 5 reports every year in respect of WhatsApp. The reason for that, of course, is that WhatsApp is encrypted. And so it has there's no ability for Facebook to prevent WhatsApp being used for child sexual exploitation online. Facebook's continuing and planning now to roll out encryption across all of its services, which will mean the vast majority of those 15 million reports of child sexual exploitation and abuse will stop. That's a fantastic example, I think, of somewhere where we can, where we know that there are protections that are easily accessible and are easily rolled out, and the internet companies are instead choosing to ignore the risks to children and roll out, excuse me, in the false name of privacy, I should say, rolling out some measures which we know will be damaging for children. So the key thing is that we can have both. We can have children being able to use innovative and interesting and fun services which are specifically designed with their developmental needs and protections in mind, and we can have spaces for adults which perhaps will be more free and less regulated. Those two don't need to be in conflict. What it does need, however, is for the companies to continue to make more efforts to understand the needs of their users, and particularly children. And it requires us to all agree that children shouldn't be treated as adults online.
Thank you, Tony. And I think we will come back to the question of governing the digital ecosystem later on in our discussion, and probably also during the Q&A. I would like to bring in Meg, because Meg, you've done some really incredibly interesting work on basically the other side of the coin, so to say. We all talk about digitalization all the time, and we all often criticize data collection and big data collection and the amassing of huge amounts of data that are basically a precondition for digitalization and for AI in healthcare and beyond. But you, in your book, point at as I said before, at the other side of the coin, which is basically the uncounted, so say the people that are not part of the data collection, people who do not basically come up in large-scale databases, whose data does not get collected. Often are minorities, marginalized people, people who have no access to the health system. Can you tell us more about the problem, so to say, of the uncounted, and what this means for health interventions that are based on digital technology, for example?
Love to. Yeah, thanks so much, Ola, and thanks to Botnar and ITU for bringing us together for this very interesting discussion. And I think, the issues that Tony has just highlighted and that the other speakers highlighted before him really point to these fundamental issues of power that shape the data that we have and the data that we don't have, and how it's used and gathered and who has control over it. And there's a real risk, I think, as we find ourselves shifting into this digital sphere, that we start to amplify existing discrimination and human rights violations and invisibilities that already exist in society. And a good case study of this, I think, is the HIV response, which is what I talk about in the book, The Uncounted, which is that, we have this global commitment to ending HIV by 2030, but the latest UNAIDS reports indicate that we are shifting very far off track. And part of the reason, one of the key reasons, is the most criminalized and vulnerable groups, the so-called key populations, who are most vulnerable to HIV, but are often in hiding or leading double lives in many countries because they're vulnerable to arrest, to discrimination and stigma, and thinking now about LGBTI plus people, sex workers, people who use drugs, who sensibly are hiding from any efforts to gather their data. But that means also that they get prey to something that we think of as a kind of data paradox, in which governments deny that these populations exist. They say, oh, we don't have homosexuality in our country, we don't have sex workers here. So they don't gather the data, and they underestimate the size and the needs of those populations. And that lack of data means the lack of resources, which in turn reinforces the lack of data. So you wind up with underestimated needs, governments thinking they're being successful in reaching marginalized groups when in fact they're actually failing to reach those groups. And when we think about how digitization might amplify this, we then wind up with a risk of much larger scale discrimination and invisibility. People who are most vulnerable to COVID, for instance, are often migrant workers. But Singapore, which has been much praised for its COVID-19 contact tracing apps, Jola Van Wam, great activist in Singapore, has pointed out, when I spoke to him for a podcast I run called the Right On Podcast, that Singapore had actually missed hundreds of migrant workers who were all living in dormitories, kind of imprisoned almost and away from the general population, who had not used the app. And so this app was sort of showing Singapore being hugely successful, but then they had hundreds of people living in overcrowded dorms who were not being counted, who were contracting COVID in large numbers. So the digital tools can actually reinforce this kind of invisibility and discrimination. And it's, bad data and bad assumptions can create bad algorithms that really get us into difficult situations, what we used to call in my younger days, garbage in, garbage out, when it comes to these algorithms.
And you said it's a question of power, or it reflects power asymmetries and power imbalances. It also reflects stigmatization. It reflects disregard of like minorities and so forth. So that kind of leads to the follow-up question: what type of governance, what type of regulation do we need then? What's your take? And maybe the others as well. I mean, Rajat, I know you're very passionate about regulation and policy. So, yeah.
I think that's a really critical question, and it's one that I'm concerned, AI for Good, I think, does a lot of good in opening up discussions about the positive things that AI can do. But I think we also need to acknowledge that AI is used for bad in many places where it's not well governed. And I'm thinking especially of China, where we have over 1 million people in concentration camps, effectively, the Uyghur Muslims, who are identified and sent to these facilities, through a mix of facial recognition, surveillance of social media, profiling people based on their opinions and their religious beliefs. And so this is, I think, a dystopic vision of what happens if we don't have human rights at the center of our governance of these new technologies. And I think we also need to think about, who should be part of those discussions and governance, and civil society groups, communities who are representing most vulnerable populations are really demanding to have a seat in governance of global health, and I think increasingly of the digital sphere. And youth should certainly be part of that, because youth in many parts of the world are now being treated as sort of the targets of experimentation for new methods to manage COVID, to manage other risks. We're seeing in the US, universities are being used to experiment as students are coming back in. If they're going to be the subject of experimentation, they certainly, ethically speaking, should have some say in the policies and in the development of new tools. And I think those probably will result in better tools. And I think we're starting to see now some of the people who in the tech sector work on, algorithmic discrimination and so forth are really starting to see a need for community involvement, even in the design of algorithms. So I think that's a very hopeful new development. Thanks.
Yassine, if I may just hand this question over to Yassine, because Yassine, you and your colleagues at the Young Experts Council, so to say, you also claim that young people are normally not involved in policy making, especially when it comes to digital questions, even though young people are probably the new experts, so to say. How do you envision a global health situation, or how do you envision policy making that would really take into account your views, your generation's views, and how do you envision having a seat at the table that's really giving you a meaningful voice? I mean, there's a lot of tokenism. Yeah, young people are now, they always get a seat at the table, but is that what you want, or what's your vision?
First, I want to thank Meg for so beautifully putting it out there. Not only that there's an issue around power, I think, and also the issue around tokenism and young people needing to be involved. And I think for me personally, when I started in the international development world, I felt not only unheard, but that there was no platform allowing us to really even be heard. And I think for me, that's really one of the reasons why I was so eager to join the Young Expert Tech for Health group, because it was one of the few opportunities or platform that would allow me to be part of the discussion. And I think with a couple of speakers have mentioned it before me, I think Tony and also Meg and even Rashad, the issue that young people, we are not a very homogeneous group. We are very diverse in terms of our experience with technology, how we came about it, and how we even perceive it in our daily views, in our daily needs. And I think taking that into account, I think international actors and governments need not only to allow us at the table, but also empower us when we're at the table. I think where many young people like me would agree is that, first of all, there's only food that allows at the table. And once we are at the table, I think, again, with the issue of power, we are not taking seriously. And so it becomes, a tokenism where we're just here for the good look of people. And I think that's very unfortunate. That's so unfortunate that we have so much to share. We have so much experiences and so much that we can bring in. And I think these are such key messages, key points that we can bring in, especially around, making sure that the technologies that are being talked about in terms of policy, in terms of even use, are reflecting of the needs that we have as young people, but also of our communities. And that's where I think we missed the line. And so to come back really to your question is, yes, we want to sit at the table, but before we get to sit at the table, we want also to be clear that as young people, we already have created our own platforms. I think technology has enabled us to really be able to talk to each other, regardless of where we are. And obviously, some of us are more privileged in that sense, given our access to technology, and others are not. And so there's already the platforms like, Young Expert, where we are already existing as a group. And I think what we need from, from older generations or from global health actors and governance is to really be empowered to take the lead, to really be empowered to be listened at. I think we can have all this platform, we can talk between each other. And the issue is when it comes to really the policy making part, where it comes to decision making, we're putting things into practice, that's where we just put on the side. And I think that ought to be changed, that ought to really be think about. And I think I think, at least for me, one of the most important thing to consider is also the issue of diversity in these young people. I think we need to be also very careful when we are invited at the table, that those of us who are at the table reflect really the true population that we are trying to serve with these policies. I think, as Tony mentioned earlier, like maybe the issues around maybe children in the Western world is completely different from, the one you would have, let's say, in Senegal, where I'm from. And I think if I'm not invited at the table to speak about my own issues, my own communities, that's already missed. And I think that brings back to the issue of power always, where we need to start thinking of technology as being maybe something to solve the issue of also, like, some people around the world dictating to other people what to do, but rather a more collaborative work. And that can only happen if you are, as young people, from my perspective, at the table and allowed to speak and being empowered to share our ideas.
Thank you, Yassine. Yeah, I fully agree. Also, when it comes to the danger of like having a kind of a selection bias, that we already like always talk to kind of the same kind of in-group of people, and we often neglect, like, we don't even realize how many people we leave out of the discussion, right? That's clearly a problem. And I think bringing in giving young people a strong voice, not just a voice and not just a seat at the table, but really like encouraging them to speak out and to listen. Or convincing ourselves to listen properly. I think this is probably a first step, but it's maybe just a step. But I would like to take this on and basically look at the private sector once again, because both Tony and Rajat, you mentioned the role of the private sector and the kind of the self commitment or the obligation of the private sector to also change the services, to make the services more child-friendly, for example, to protect users, to develop more fair AI, to develop better data sets, to develop better regulation and so forth. But I wonder, how realistic is it really to expect the private sector, to expect the service providers to develop different tools or to develop a better technology, a more responsible technology? Because in the end, it's the business model on which they are based, right? Can we really expect them to change the business model if they don't have to, if they are not forced by government regulation? Will they do it for voluntarily? What do you think?
Well, I mean, sorry for jumping in, Rajat. I think the first thing to say is that they haven't, and this problem has been clear for 10, perhaps 15 years. Some people were talking about it. So the fact that they have not bothered to develop any sense of a real self-regulatory action over the course of the last 10 to 15 years shows that they won't. And as you say, at the moment, there is no competitive advantage for the services to be better on child safety, health and well-being than others. And what we've had, certainly in the UK and the EU over the last few years, is that we've had small amounts of movement and small changes to features that have come in as a result of tragedies and crises that have happened. It simply isn't good enough for the companies only to make changes when we as NGOs point out the massive failings and flaws in their services. That simply isn't the right way to go when a third of internet users, 1 billion children, are online. I mean, it's completely unacceptable to expect these companies to do the right thing. And as I used some examples before of companies actually doing the wrong thing, of intentionally going in the opposite direction rather than making movements. So we can't expect that these people will make the choices, and part of that is because they don't understand the risks that their services pose to children in the first place.
Just to briefly add further to what Toby said, and I think this culture of trust us and we mean good doesn't deliver. And let's just be clear. And it's fascinating, we've talked about power as a lens repeatedly in this conversation. The other side of power is politics. And we need to look at the two and the interplay together. And Philip Alston, the former UN Special Rapporteur on Extreme Poverty, very famously remarked that the digitization of welfare system has very often been used to promote deep restriction and overall welfare budgets, but also, as he said, complete reversal of the traditional notion that the state should be accountable to the individuals. States obviously bear the primary duty and responsibility to promote, protect, and fulfill the human rights of individuals, and also ensure that non-state actors and private entities do not promote discriminatory or harmful practices. Now, over the past few years, there have been a proliferation of ethics initiatives and other soft law norms to regulate and control digital technologies. However, if you actually look at any of them, you would be hard-pressed to find any meaningful reference to human rights in them. The issue with company-developed ethical standards or regulations is that they fundamentally rely on the fact that companies have good intentions. And it is a classic paradigm of the fox guarding the hen house, and something which Tony very rightly elaborated on. And everybody agrees technology should be ethical. But then they differ enormously on what ethics actually means. And this is why human rights frameworks are so critically important, because it does not leave the governance issues to the whim and fancy of what one major tech company might feel that it wants to voluntarily do from the other one, but it is a matter of international law that we must be governed by. And this is what Amnesty, along with Access Now, tried to address through the Toronto Declaration in May 2018. International law standards provide well-established framework of universal binding and actionable laws. And one of the things that, one of the biggest issues, I should say, with the ethical frameworks developed by companies themselves is that don't create any actual accountability and are often used as a tool to deflect criticism. For example, how are Google and IBM's ethical principles enforced? Would they ever admit publicly that they have violated their own ethical frameworks? And if they did, who is going to do anything about it? And these raise some fundamental questions because, and it goes to Ula, as you were saying, the very business model through which these companies operate. And until recently, the prevailing wisdom has been that these companies could regulate themselves. However, as one scandal after another has shown, this is not the case. Now is actually the time for government action, and we need a structured approach that tackles both the abusive business models that have been talked about, but also the concentration of power. At the same time, as pointing to the human rights harms of surveillance-based business models, it is our responsibility to also articulate a positive vision for future of a rights-based digital ecosystem. And this is where I think this conversation needs to deepen further in terms of the kind of partnerships and representation issues that we are talking about, and how do we meaningfully ensure that marginalized groups such as children, young people, and others are actually represented in the decision-making forum, and what would it exactly look like? And I hope through the Q&A, we can look at some of those issues further. Back to you, Ula.
Yeah, thank you very much, Rajat. Very, very strong, powerful statement. Again, I think before we open the floor for questions and answers from the audience, I would use your final point, Rajat, to lead on to Meg, because Meg, you have basically done research in your previous research. You have shown how different models of participation of governance could actually lead to a more integrative, to a broader participation, and how it could become feasible to bring in different groups into policymaking and to give them to give them a voice in the debate. Could you elaborate a little bit on this, because I think it really follows up nicely from what Rajat has actually just called for. What can we learn? What can we learn from your previous work?
Yes, thank you. And I totally agree with everything that Rajat was just saying. I think I would add to that before I talk about to answer your question, that how important it is now that we need UN agencies also to take a clear stand on the human rights risks and on governance, and what kinds of governance needs to be put in place in order to appropriately regulate new technologies. Because I think at the moment, we're in a moment of great excitement about the potential of digital technologies, especially in health. But I'm a little concerned that we're seeing the very rapid scale up of pilot interventions that are not really fully evidence-based, the rapid, racing into these new private sector partnerships, with Google and with MasterCard and with all these different companies without really doing the due diligence. And so I think it's really critical that we push our partners in the UN to clarify what kinds of governance needs to be in place. Then I think one piece of that has to be rethinking the power relationships around data and the kinds of meaningful representation, not tokenistic representation, as Yassine was very rightly pointing out, that we need to start thinking about models of participatory action research that engage communities in defining what kinds of data should be gathered, and gathering the data themselves, and in retaining some degree of control over the data. So it's not just this kind of data colonialism, extraction of data from different communities, but actually ensuring some community ownership. So the work that I described in the Uncounted, and that I'm now starting to do in the digital space, is about bringing together civil society, government officials, academics, UN partners, to work together to really both put civil society at the center, gathering that data for themselves and community-led groups, but also ensure that they're then positioned to lead on interventions that are fully funded once they have the data and they become experts on it. So I can describe that more in the Q&A, but I don't want to stop you from moving to that. Thank you.
Thank you very much. Okay, so I think we should open the floor for questions and answers from the audience. I can perhaps pick up some of the questions that I can see here in the Q&A box, but please feel free, everyone, to add more questions. We have about, well, 10 minutes, but yeah, at least. So here's, for example, one interesting question, I think, that follows pretty much on what we've discussed so far. And this is it's a question from William. Is it possible for singular governments to establish effective digital legislation, given that many tech platforms are multinational in nature? If not governments, who has the capacity to implement this governance? I don't know who feels tempted to answer that question, but yeah, is it possible for one government or for a singular government to establish effective legislation?
I'm happy to add, and I'm sure other colleagues will have something further to say. And this is where, actually building on what Meg was just saying in her final remarks, in terms of the role of multilateral system and our partners in the United Nations is very profound. And I know there are discussions which are ongoing in terms of coming up and looking at digital architecture for governance at a global level. But also, I think this is where we need to look at issues around governance and regulation more from an ecosystem approach rather than one-off ad hoc mechanisms or interventions. From what we are looking at, the UN and such other multilateral bodies is rules and standards which can help govern entities across the board rather than what we seem to be presently in a firefighting mode, constantly from one scandal, one matter of abuse on one platform to the other. So what I think what we need is to develop, and it is a complex ecosystem that we need to address. And through that, I think we will be able to penetrate into certain specifics. And there are learnings. There are some profound learnings in global health, for instance, in terms of how this can be done, and how we have addressed issues, deeper issues around accountability by implementing what we call within that sphere as social accountability approaches, for instance. But what would a social accountability approach look like in a digital sphere, and what are the standards that we are looking at? This is where we need to have multilateral system work very closely with civil society and other partners to come up with meaningful solutions rather than band-aid measures is what we are at the moment.
I think that's really interesting, Raja. And I think that these, the companies, I think it is in the company's interests to tell us that online services that are multinational can't be regulated at the national level. So I don't think we should take that as an automatic without questioning it really carefully. And of course, we know that through the network effect that it's that many people will be exposed to content from different countries, of course, and so that any regulation that happens at the national level will have to be intelligent enough to take into account the best efforts that companies can make to adhere to domestic laws. However, tackling multinationals at a national level is not a new problem. We have been experiencing this in over 100 years in multinational companies that operate in more than one country. At a really simplistic level, for instance, a multinational oil company employs people in the UK and also employs people in the US. It has to adhere to different health and safety standards, different training standards, and all of those kind of things. Now that's relatively simple. It's much more complicated when you're talking about networks and algorithms and AI which surface content internationally. There are steps that have been made in this direction. So for instance, we all know about the new content removal laws in Germany, where companies are required to take down content that doesn't meet their standards very, very quickly. I think that we're still on the track there, and any regulation that's developed nationally will have to be developed with a really sound understanding of the needs of users and the ways that these companies operate. And I don't think yet that any nation state that I've found has employed enough people with the right understanding of the technology to be able to do that kind of intelligent regulation. but it's not an impossible challenge. And movements like recognizing children's rights online through the UNCRC are a good step to start to create the worldwide regulation that we need. I should say that we can't wait for that kind of worldwide agreement on exactly what needs to happen. And those countries which are further ahead here, those territories, including the EU, UK, Australia, and Canada, need to be forging ahead, because the risks to children from unregulated services are so clear, and we simply can't wait for the rest of the world to agree. The problem there, and I think Yassine mentioned something about this, the problem there is that we can't end up with a system where we have a two-tier. So we have a very small number of countries that have well-regulated services that are safe for children, and the rest of the world is a test bed for companies to provide risky services. So the key thing for me is going to be ensuring that the regulation that is coming, and it really is coming in some of those territories I mentioned, is transmissible to other territories, and is seen as a way of testing and seeing what works and what we can roll out easily on a wider scale. It's worth mentioning, of course, I don't think we've had any mention yet of GDPR, which is a very strange time. Usually in these seminars, it's one of the first things that comes up. We've seen companies, including large multinationals, realizing that it's just simpler for them to roll out GDPR level standards across the world in many territories because they are being forced to in the EU. Now, I'm not necessarily sure whether that's the right way to go, but I'm sure that when companies realize that there is a better way of doing business that is compliant with their largest territories, then they will start to roll that out, including in sub-Saharan Africa as well.
And if I may just add to that, I think you've mentioned it. When it comes to having the regulation at an international and national level, I think we also have to be really clear that certain structures, certain government don't have the power to reinforce the regulation. And especially when I look at sub-Saharan Africa, where governance is done differently, and these multinational have a lot of power in here. And I think that really begs the question to see whether those, where these multinational companies are from, being like the UK, the US, or the EU, whether they are also ready to, when they enact this regulation for themselves, whether they are also ready to hold their own companies accountable for the rest of the world, and also empower the rest of the governments around the world to be able to stand up to these multinational companies, rather than having, okay, we are going to act really well in these countries, but then the rest of the world is our testing ground where we can do wherever we want because we have the power and governance is done differently. So I think that's something we need to consider and think about in this discussion around regulation.
Maybe just if I may use my my role as a moderator, maybe I was wondering, isn't there also a certain danger now that we see geopolitics coming in the way of increased regulation and improved regulation? Can't we see right now that big tech companies are actually used by certain governments to promote and foster actually quite national goals? For example, I mean, the one reason why the US administration opposes stronger regulation is apparently also because they see a strong value in having these strong unregulated tech companies, right? So, and the same can be said probably about China and so forth. So don't we see that actually regulation, or that geopolitics is coming in the way of regulation?
No, definitely. And I would love to hear other views on that as well. And then this is where I go back to the point I was trying to previously make, is the other side of power is politics, and how is politics informing some of these decision-making that is taking place. And let's be clear, I think there is an issue in here in terms of the business model of the big tech companies, which thrives on these geopolitical disconnects, and the fact that they are able to exploit weak governance systems, as Yassine was pointing out, in countries to actually launch interventions and technology without having robust safeguards and use it for market exploitation. And then I think increasingly we are seeing that to be the trend that is happening, and the role that their lobbyists and others play, and their connections with the government. Having said that, this is not new. We do know about the experience, and this is where also it would be important to remind ourselves of the UN guiding principles on business and human rights, which imposes strict responsibilities on private entities and businesses in terms of their obligation to protect human rights through their spheres of influence and their conduct and business operations. Technological companies are not, that was a Freudian slip, are not, immune to these regulations. They are part of these regulations. And the question is as been very articulately pointed out by other panelists, is what would that regulation look like? And where are the learnings in terms of different countries and territories, and how that can be exported to other areas as well?
If I could just jump in, I mean, I totally agree with Rajat. I think the challenge is that the UN agencies and states have proven themselves to be weak in the face of these tech interests. And I think when we've seen this before, for instance, in the HIV sector, where nobody was really willing to stand up to big pharma and demand affordability in terms of medicines and widespread access, it was a popular movement that changed that. And so I think, though I know that Botnar Foundation doesn't necessarily consider itself to be a movement building agency, but I think your investment in building youth networks and empowering youth to speak for themselves is absolutely critical, because I think if we don't have a real public demand for greater transparency and accountability and to push back on some of these abuses, nothing will change. I mean, we can have the best laws and guidance coming out of the UN and governments in the world, but it's really, it comes down to a question of political power, I think, as Rajat was saying.
Thank you, Meg. I think we have time for one last question from the audience. And here's one that maybe is also a bit more optimistic, so to say. The question is, let me rephrase it. Will there be technical processes, technical tools that can enable the auditing and watching of all things digital or AI worldwide, and the enforcing of their goodness? So will there be a technological solution to the problem of technological evil, so to say? What does the audience, what do the panelists think?
I'm sure that everyone has their own views on this, but I would just say that I think that the tech community has an important role to play. I think there are certain technological innovations that can be hugely important, but you can't fix a problem of power with a silver bullet. So it requires really sort of larger shifts, I would say, but curious to hear what the others think.
I'm so sorry, Roger, you go ahead.
Just very briefly to say, in agreement with Meg on this totally. I think these are complex issues, and technology can unfortunately mask the complexity of these issues. So I do think it will have a role to play, but probably not the sole determinant of these fixes as such. Back to you, Toby.
Well, I think there are tech solutions to many of the problems, and they're actually, my specialism is on child sexual abuse online, and actually there are tools that could be used really simply if companies chose to use them to reduce the spread and sharing of known images of child sexual abuse online. Companies choose not to for various reasons, in part because they'd like to pretend to be privacy enhancing, and in part because they'd prefer not to have large numbers of reports of child sexual abuse on their platforms. So there are tech solutions to some of these problems. I think ultimately, as Meg says, this is a business question. So at what point does it become uneconomic for these companies to continue to expose children to risk online? And regulation will only work if it actually makes it easier for these companies to comply, easier for them to understand the needs of their users, their young users in particular, and easier for them to be safe. At the moment, the system works entirely in the other direction and makes it easier for them to ignore children's needs and rights online. And that simply is why we're in the mess that we are right now.
I think just to add this to this, I think like Mike said, it's an economical issue. And I think that's really where I would not say a technical process or a process, but rather a human one. I think we have much more power than we are made to think. And I think, again, it's economic, it's capitalism. So I think the question is that we need to self-reflect and see, are we willing to hold these companies responsible? Am I willing to download into delete Instagram if I believe that they are, participating in these abuses? So I think that's where also we need to really look into our power and how we can push these companies to act right or act the way we want them, because at the end of the day, they want our business and we are the one who makes them survive. So how can we, at the individual level, at the community level, push them to really abide by these rules?
Thank you so much. Thank you, Yassine. We have more power than we are made to think. That's what you just said, and I think those are very beautiful and very strong closing words. And I think we should leave the discussion with this strong and encouraging sentence and thought. So it was a great pleasure to have you all on this panel, and I'm now handing it over to Stefan Germann, the CEO of Fondation Botnar, to give us his closing remarks. Stefan, the floor is yours.
Thank you very much. It's very interesting to listen to the panel and the discussions that we had. So it is amazing that we are together here digitally. At the same time, we have clearly seen in this session the enormous challenges that lie ahead. I would like to start sort of with two quotes actually of a very famous psychoanalyst and the founder of analytical psychology. Whilst he took it at the individual level, I would like to bring that up to the collective level as sort of a collective persona as our society. The first quote is, "Your visions will become clear only when you can look into your own heart. Who looks outside dreams, who looks inside awakens." I think we heard from Rajat and Tony, but as well Yassine and Meg, very clearly that currently we are very much on the technology driven. We are looking at the technology, whereas we are not looking at the human side of what this technology actually does to us as a collective humanity, and therefore as well as individuals. Sessions like this are absolutely critical. In light of another quote from C.G. Jung, he once made the statement that until you make the unconscious conscious, it will direct your life and you will call it fate. If we take that into a digital sort of collective persona as global society, we have enormous blind spots related to digital. We have been sort of following the sort of, in quotes, the gospel of technology and digitalization, but we have an enormous unconsciousness that we need to make conscious so that we actually can fully leverage the potential of digital in the years and decades to come. I think Tony mentioned a few times, that we do sort of, a scandal happens and then we patch up here and there. Currently, it's very much a sort of a Band-Aid approach, that whenever something goes wrong, we put a Band-Aid on it. When something new pops up, and it's kind of amazing that technology companies who drive these technologies seem to have so many blind spots in terms of what the technology has in terms of long-term consequences on individuals and societies. I would like to highlight the report by Philip Alston, who is the special rapporteur on extreme poverty. He wrote a report last year to the UN General Assembly on the digital welfare state. In his foreword, he put a strong, stark warning that we are collectively at a great risk of all of us stumbling zombie-like into a digital welfare dystopia. Now, I'm very positive on technology, but we need to be very clear that unless we actually start collectively to understand where these blind spots are, to start to look into ourselves in terms of these technologies and what they do, only then the awakening will come and the situation can change. This session was really an excellent effort to contribute and to start this journey that many of you, like Amnesty International, MEG, the Unseen, those who were on the panel have started some time ago, is to contribute towards a collective consciousness of what technology in the 21st century and what AI, digital transformation and frontier technologies do in terms of the future of us as a collective humanity. Unless this is very much rooted within existing human rights frameworks, but understanding the evolving of these frameworks within a digital society with all its complexities and possibilities, only then can we truly leverage digital for the well-being of humanity. Thank you.
Thank you very much, Stefan, for your excellent closing remarks. And we would like to thank once again Fondation Botnar for your continuous support and for putting this panel together. For those who are interested in the topic of AI for Health, we also invite you to check the work of the AI for Good focus group, AI for Health, that is run in partnership with WHO. And you can find the hyperlink to the webpage right in the chat now. We would like to thank once again all our partners, sponsors, and Switzerland for your continuing support. Thank you, everyone, and hope to see you soon.